So there's been many studies over the years, dating back 30, 40 years, trying to improve the outcomes for patients with renal tumors, generally large renal tumors or tumors that invade the vena cava that have a higher risk of relapse after surgery. And can you do anything to decrease that risk of relapse? So for the longest time we've really had no benefit, meaning that all these studies, these are all randomized trials. Patients get treated, either get placebo or no treatment versus treatment, and really there's never been an improvement in overall survival. There's many of these studies are cooperative group, and studied with sunitinib, pazopanib, sorafenib, and more recently one study actually did show a benefit for patients in terms of progression-free survival. These are patients with T3 and T4 kidney cancer, a really high-risk subset. Many of the other trials would include slightly lower risk T2 or even T1b in some of them, which is related to the size of the tumor. And this showed there was an improvement in progression-free survival, meaning that the patients who went on sunitinib for about a year seemed to have a lower risk of progression, though there was no improvement in overall survival. So the patients didn't seem to live any longer as of yet. There's continued follow-up, but there was an improvement in progression-free survival. Based on that, the FDA or the NCCN guidelines actually changed, which now shows in the NCCN guidelines, it is an option for treatment. You could still do observation, or you could consider giving sunitinib adjuvant therapy.